Nakuru County is among the 5 counties slapped on lockdown in a bid to avert a national crisis as the country braces for the 3rd wave of COVID-19. Midrift Human Rights Network in Nakuru has put in place operational strategies in the circumstances that have forced the organization to scale down activities.
You will realize that our work is about interacting with the communities, because that's where we want to create change. That's where we want to create resilience. And therefore, with some of these regulations and the lockdown and Ministry of Health protocols, it's very, very hard for us to go and work with the communities, because our work is not based in the boardrooms. The change we want to create at the grassroots level.
Large-scale community interventions were scaled down. We encourage staff as much as possible to work from home. Where we do have to have community engagements, then these have to be conducted in compliance with the government directives of the limited number of people, open spaces that are aerated, and keeping social distance.
Through implementation of our program, the pandemic came and it really affected all our programming as an institution due to coronavirus. Then again, with the stringent measures that are being revived every now and then in terms of locking up some counties, just like what the president recently announced, locking up the 5 counties within this region, it has really affected our programming.
Deeply rooted in the communities, Midrift is implementing 5 programs under thematic areas of human rights and governance, peace and security.
Coronavirus has compounded the issues whereby people have lost jobs. It has created tensions within the households. Gender-based violence has increased to the community level, and here's the situation whereby we want to intervene, but the protocols do not allow.
It has very much affected our strategic planning in terms of program work plans, where most of our activities are based on meetings. So we have to either shift from the physical meetings or live meetings to either online virtual meetings, just like we did with the place-based research development program.
First of all, we have to ensure that our programs, the implementation of our program adheres to the Government of Kenya directives for containment of COVID-19, as well as the World Health Organization advisories. So what that meant at a practical level is that we had to cut down on our community interactions. We do not want a situation where our staff are conducting community meetings, bringing to a lot of people in one location.
What we are also doing is now to create strategies of what can we do with the circumstances, because this is the new normal. So we are trying to map out key stakeholders so that we can be having online meetings. We can also be organizing webinars, at least with the key stakeholders who are mandated to address issues of whether it's security or health.
Since the advent of the pandemic, the organization has worked in partnership with the Office of the County Commissioner, the National Police Service, Ministry of Health officials, among other stakeholders, to mitigate the effects and the spread of COVID-19 pandemic.
Corona taught us one thing: both is a health issue and also is a security issue. And that's where there was a lot of collaboration between the Ministry of Interior and the Ministry of Health in addressing the corona. And we managed to take some of these particular experts, the radio station, to talk about these particular issues and also encourage people to follow the protocols. We can scale it up, provided that there is availability of government agencies to second people.
Most of our programs are target-based in terms of having strongly embedded monitoring and evaluation into our programming, where we have targets. So if, for instance, the meetings are revived to people meeting because of the pandemic, you meet only 15 people, and you had planned to have a gathering of around 200, then it means you have to do so many meetings to reach that 200 target. Then it means you cannot, it's not sustainably possible for us to have meetings. So pandemic has really affected most of our programs.
In the office, we have had to do some restructuring in terms of reorganizing the physical space to ensure that whenever staff are sitting, if in case they do come to the office, where they sit with some distance between them. With that regard, we reorganized, we moved the finance office to a more spacious space. We also added the workstations within the main workspace, and we have an annex, an unused building that we had in the office that has now been converted into a working space where some more of the staff members now sit. Luckily, our partners are very flexible, and they are also listening partners. And periodically we conduct what we call real-time evaluation of activities. The real-time evaluations serve to gauge what is it we are doing at a particular moment, what is the impact of what we are doing, have there been any lessons that we can learn to inform subsequent activity implementation, and so on.
I know right now Nakuru County people have been told to work at home, but we can talk with some of the departments to see that some of these people can be available, either for radio or TV. And if need be, because 2 weeks ago, we managed to give a public address, the Minister of Interior, to go and do the announcements of the new directives from the head of state, so that people are aware, because not everybody has a radio or a TV station. Yeah, so those are the collaborations that we need to scale up.
Looking forward, I think, as many say that COVID-19 is the new normal, and if it continues that way, and of course even for remedial measures, we just have to do replanning, and of course if it calls for, we might even be redesigning our programs just to fit the new normal.
The vaccination is that is the one and only sure bet we have at the moment of putting a hold onto the spread of this disease. We would encourage the general population to go for the COVID-19 vaccination, because that is the only thing we have standing between us and the pandemic.
The advice to the residents of Nakuru County, for that matter, where we work and live, is that let us adhere to the directives that the Minister of Health has given, the directives that the President has given. If we are able to follow those particular protocols and regulations that we have been told to adhere to, we can be able to quickly address the curve, and therefore some of these particular restrictions can be lifted.